Wonderful. I hope you had an awesome day, a wonderful week. I'm excited to share some information with you. I was on a call yesterday, just conducting my usual marketing strategy session. I've done this for 13 years, just hop on calls with dentists, look at their goals, and just give guidance on what they're doing for marketing. And in this conversation, I was talking to a new practice owner. I believe it was a startup conversation, and we were planning and coming up with the marketing strategy. And when we do this, it's always a very individualized process of evaluating competition and market and ideal new patient and brand and all of those things that go into making these decisions. And the question came up that was kind of like, well, if the DSO or corporate practice down the street is doing mailers, I would imagine that these mailers are effective or they wouldn't be spending money. And I think the implication there is that the DSOs or corporate dental practices have enough resources and knowledge to make wise marketing decisions. So if they're doing it, I should probably be doing it. And so it gave me kind of an idea for a video. So here we are. And I'm going to break down why corporate practices might invest in mailers when it may not be a fit for you to invest in mailers. So first things first, corporate dental offices, a lot of times after you get to the point of 5 or 10 practices, financially, it makes sense to bring the marketing team in-house. So a lot of times you'll have kind of like an agency within the business. And it's been my experience that although they might have some talented people on the team, there's usually a lack of knowledge in the leadership department. And so a lot of times, even though the employees are maybe very talented and doing a great job, if the leaders of those employees are more business-minded financial people, or they're even dentists, they may not have the right guidance as to what they should do and why. So number one, there might be some waste in that strategy. You don't want to go into this assuming that because they're doing it, it's providing a positive ROI, or don't make the assumption that because they're doing it, it's the next best thing for them. They might be missing other potential better opportunities than this particular mailer. Now, I want to start, before I go into my other 4 reasons as to why they might be doing this, I want to let you know, we do offer mailers at Identity Dental Marketing, and it is one of our services. It makes sense in some situations, but not all situations. So by no means am I like saying don't do mailers or mailers are bad. We do offer that, but we'll advise you when it makes sense and what to expect out of it based on you, your goals, your service offerings, your special offers, whatever that might be. Okay, so the second reason is they don't always have the best tracking or software protocol. So they might be saying, okay, we've got X amount of dollars per practice to invest in marketing, let's get it done, but then they don't really understand analytics and dashboards. I'm sure there is some understanding of return on investment, and I'm sure there's some tracking at some level, but it's not always the most sophisticated. So they might be doing it because it's what they've always done. And chances are, they're already investing in digital marketing too. So another reason is they may have capped out on the digital marketing where they're putting so much into that they've reached the point of diminishing returns. And it also makes sense for them to market with the mailers, even though it may not be the first place that you start in your practice. They might be at the point where that's the next best thing for them as they continue to grow. So the other reason is just they've already done digital marketing and they're already tapping into that. So they see a benefit in both, even though the mailers may be more expensive and they may not yield as high of a return on investment. They're still seeing a positive return on investment and they still think it's worth their time. But as a startup business, like the doctor that I was speaking to, they don't have unlimited budget for this. So they need to evaluate what's their next best move to get some momentum and to get patients in the chair. So, I kind of would draw that comparison for the doctor. Another reason that a corporate owned practice might run mailers is that they're aggressive on low cost offers. They might put out messages like free or cheap or $39, $29, $2,000 implants. I've I've seen everything out there in terms of offers, and those low cost offers are perfectly fine for them. If that's bringing in a patient that they can convert and that they can make a profit on, they're happy about that. But a lot of times my privately owned practices, my doctors of privately owned practices don't necessarily want to go in that route, because they know the patients that they're going to see from the low cost offers, they are coming in because of price. They're harder to convert. They're harder to get to accept treatment. But when you're working in a very corporate, maybe like a larger business setting, there's pros and cons there. I'm not saying anything bad about big business by any means. But sometimes in that environment, they know, like, sure, it might cost me $400 or $500 to get this patient in, but 50% or 80% of the patients that come in on this particular mailer have treatment that they need to complete. And the lifetime value of that patient is X. It might be 2,000, 3,000, 5,000, 10,000. So they're looking at their sales training. They're looking at their conversion rates. They're really looking at their return on investment long-term. And when you compare that to the goals of a private practice owner, they might call me and say, I really don't want the wrong type of patient. I really want a patient that's going to value my expertise and my team. And I don't want them coming in for just the cheapest care. I really take my time with patients. I want them to call me for X, Y, Z. And we help them articulate that. We help them define that. And then we match the marketing that accomplishes that. So the takeaway here is I'm not encouraging you to invest in mailers, and I'm not discouraging you to invest in mailers. I just don't want you to assume that the dentist down the street is doing all the things right, whether they're, corporate, multi-practice, or very successful. There still is a lot of waste in these marketing programs when I end up popping the hood, when I look at the ads campaign, or when I look at the mailer, when I look at even return on investment or the type of patients that are coming in, I see that a lot of times what we think is, these big monster businesses with deep pockets, and they've got private equity money or whatever it is. You think, oh, they've got to be doing it right. Sometimes it's not actually the most efficient way to market the practice. So again, take an individualized approach to your marketing plan, the same way you take an individualized approach to each patient's treatment plan. Thank you for joining me today. I hope you have a great night and a wonderful weekend, and I will see you next time.